Our next presenter is Dr. Geiger, presenting his presentation on maternally derived colostrum immunoglobulins to replace maternal colostrum in neonatal calves. The floor is yours.
Thank you for the introduction. Today we're going to talk about the impact of a commercially available colostrum replacer on achieving passive transfer in newborn calves, and also some of the factors that impact the efficacy of that product. So this is my one-slide introduction as to why colostrum is important. I think this group here very well understands the importance of colostrum to the newborn calf. There's multiple reasons for that, and I'm not doing it justice by only presenting one of those reasons. But this is data from the USDA back in 1993 that is still very highly cited today that shows that calves that do not achieve successful passive transfer, defined as a serum IgG content of less than 10 milligrams per milliliter, are more likely to die in early life during the pre-weaning period, are more likely to have other complications such as morbidity and higher treatment costs throughout their early life. Multiple groups now use the 5 Qs of colostrum management to talk about maternal colostrum and sometimes how maternal colostrum can fall short. Maternal colostrum is certainly the gold standard for our baby calves when we're talking about achieving successful passive transfer. The nutrients that we are aware of that are available in colostrum, as well as the ones we are not yet aware of, are numerous. When we talk about the 5 Qs of colostrum, I would like to first talk about the upper right pentagon, the quality. We want a colostrum that is of 50 grams per liter in terms of IgG content in that colostrum, and we know that that can vary a lot by animal, and it can vary a lot by farm, and there's multiple things that can impact the quality of maternal colostrum. We do have the ability, however, though, to measure that on farm. When we talk about quantity, I like to talk about it in terms of the amount of IgGs we are providing that calf. The Davis and Drakely book from 1998 and multiple other studies have shown that that quantity of IgGs provided to calves within the first or immediately after birth should be somewhere between 150 to 200 grams of IgG. When we talk about quickness, we want to be getting the colostrum out of the dam as soon as possible, preferably within the first 2 hours after parturition. And we also want to feed the calf as quickly as possible because we know that her ability to utilize and absorb those immunoglobulins decreases as she ages. We also want to make sure that that colostrum is clean because we know that a higher bacterial load in colostrum decreases serum IgG content in our calves. And we also want to make sure that we're checking in on our calves and seeing how they did after we fed them maternal colostrum. When we talk about achieving successful passive transfer, again, we're talking about 10 milligrams per mils of IgG in the serum, and benchmarking to making sure we're achieving that is very important for the farms that we're working with. Now, I show you all of this because when we talk about maternal colostrum, our goal is for maternal colostrums to meet these 5 Qs, but sometimes it simply does not, which is why alternative options are very, very lucrative to us and to our customers that we work with. So the objectives of this study were, 1, to determine if the colostrum replacer that we used in this trial or in these series of trials was able to successfully achieve successful passive transfer in baby calves, and also determine what the apparent efficiency of absorption of IgG for those calves was, and then also to determine the factors in some of these trials that may or may not have impacted the ability of those calves to achieve successful passive transfer. So this is an example of one of the products that was used and fed to calves. There was 389 total calves spread across 10 studies that were fed for the purpose of this talk. The IgG source was 100% bovine IgG from first and second milkings. This product was unique in the fact that it had fat and casein removed from it. So for lack of a better term, it was essentially a purified whey source. It was fed via bottle within the first 1.5 hours of birth. If the calf did not consume it via bottle, it was tube fed. Blood samples were taken at 0 hours or immediately after birth, before colostrum was fed, and again at 24 hours post-feeding. And removal criteria were applied in this study: calves that were born to a difficult birth, calves that were born as twins, or calves that were perceived to have suckled maternal colostrum directly from their dam were removed from this study and not included in analysis. So here are some of the variables that were analyzed in this talk in terms of the impact on apparent efficiency of absorption and serum IgG at 24 hours of life. These were the variables that were put into the model. So you can see we have birth weight, which ranged from 15.6 to 52.2 kilograms. We looked at the total amount of powder fed, so that was the colostrum replacer, the total amount fed. You can see the values there. We looked at the total grams of IgG fed, and we also looked at the IgG content, which ranged from 21 to 42%. We looked at the dosage, which was the grams of IgG provided per kilogram of birth weight. We assessed the location, which you can see there, the gender, the breed. We looked at Holstein Jerseys, Holstein Jersey crosses, and Japanese black calves, and then the number of feedings that colostrum replacer was provided in, either 1 or 2 feedings. Here is a summary of the raw data of what I just discussed from these trials. Here you can see each of the trials listed, the number of calves, the sex, the total amount of colostrum fed, and so on and so forth, as well as the average for that study of serum IgG and apparent efficiency of absorption. I highlight these 4 studies in yellow. These are 4 studies that were very similar in the sense that they provided 150 grams of IgG to those calves within 2 hours of birth. It's a recommendation that at least in North America is becoming quite common, so I wanted to highlight those for you. In terms of a statistical analysis, serum IgG was compared to the industry benchmark of 10 milligrams per mil. We used univariate, multivariate, linear mixed effects to determine the impact of our covariates. And our numeric factors and variables that we assessed were total colostrum replacer fed in grams, total IgG fed in grams, and then also that IgG content, which was a percentage. We used backward stepwise comparison on our covariates until all the remaining variables were associated. We did adjust p-values and use multiple comparisons. The study ID for each trial served as a random effect and was not significant, and our significance was declared at a p-value of less than 0.05. So some of the overall raw results from these studies: the average serum IgG across studies was 17.59 milligrams per milliliter, and that was significantly greater than the industry benchmark of 10 milligrams per milliliter. Our failure, and you can see here, these are and I forgot to mention that on the last slide, these are the number of calves that failed per study. The total failure rate was just south of 2.5% failure passive transfer rate, and the average efficiency of absorption across these studies was 35.3%. So we look at the results for serum IgG at 24 hours post-feeding, again with the average of 17.59. That was greater, again, than 10 milligrams per mil. And the only thing or variable that we found that significantly impacted that was dosage. Dosage, which was significantly correlated with serum IgG at 24 hours of life, wherein every 1 gram increase per kilogram of body weight in terms of dosage resulted in a corresponding roughly 4 milligram per mil increase in serum IgG at 24 hours post-feeding. When we look at the results for apparent efficiency of absorption, most of our variables were not correlated. However, dosage was again correlated with apparent efficiency of absorption. In this instance, it was a negative correlation. For every 1 gram per kilogram of body weight increase in dosage, we saw apparent efficiency of absorption decrease by 5.5%. So in conclusion, what we found from this work was that utilization of this commercially available colostrum replacer resulted in an achievement of passive transfer with a product that was a relatively low feeding rate and a high IgG content. But most of our variables that we looked at were not associated with serum IgG or apparent efficiency of absorption. with the exception of dosage, which I think brings about some very interesting points. Our greater dosage increased with serum IgG. So, a greater dosage was associated with the increase in serum IgG. So if we assume the same amount of immunoglobulins being offered, that means our calf weight is getting smaller. Or, on the contrary, if we assume a relatively stable body weight, that means that we are providing less IgG. So what that means, and it confirms what we've heard in other studies and in other talks that experts have given, when calves are larger, we need to look at providing them a higher amount of colostral immunoglobulins. And when we look at a greater dosage resulting in a reduction of apparent efficiency of absorption of those immunoglobulins, it's a similar conversation that we can have. As our calves get smaller, we do not potentially need to offer them the same amount of immunoglobulins because at some point, the efficiency with which they can absorb those immunoglobulins plateaus. Now, again, here we're talking about a systemic effect. If we want to talk about the local impacts that may result from those immunoglobulins in the animals, regardless of body weight, that's a different conversation. But at least for the case of this study, we could see that as animals get smaller, our efficiency, by providing those high levels of immunoglobulins, our efficiency is decreasing. So from an efficiency standpoint, we may be able to offer them less. So the results within this study and this analysis provide us alternative options and approaches for colostrum. Again, noting that maternal colostrum is the gold standard, but in areas where colostrum quality may not be where we want it to be, or in situations where we have difficult birthings or calves that are unable to suckle on their own, we have another option with some of these colostrum replacers. And producers should be able to use them with high quality, or a high quality one with high confidence. And I'll take any questions. Thank you.